Good day, my fellow nurses. For today's case, we're going to talk about an obstetric situation by Jenna Bay. So stay tuned for the questions, answers, and additional information about the situation. Brought to you by this video, along with our guest, the Nursing Prof and Intermountain Healthcare. So once again, I am Corbin and I'll be your nurse for today. So, the situation starts with Jenna Bay, our patient. A 21-year-old is 6-hour postpartum who had given birth vaginally to a bouncing baby girl weighing 8 pounds. In the OB ward, her husband was so excited to hold the baby in his arms, but Mrs. Bay suddenly said,
Kaso, agad na kasi. Anong ko na pumiskisa? Nagkapalis na rin. Ako na pumisa.
she seems like she's not ready to breastfeed because of her behavior. Additionally,
Nangalaga ni Bakakam nurse. Nagasang niya ba o? Ito makikid yan eh. Nasisigan ko.
her husband tried to reassure her, but then she starts to cry for no reason. And then the husband remained quiet and asked the nurse,
Paano tuman nurse eh? Akin man si aso, akin siya aliwang malikot.
"Okay na, yan to tayo, malikot tayo, gabay mo na ibaga."
Amay no, di ba no balon man alak? Dapat siya malikot dapat.
Sige, tanong naman tayo. Now that the situation is out of the way, let's go to the assessment. So first, the patient is primipara, meaning that the patient is a woman who gave birth for the first time. After that, the patient has undergone a labor and delivery without any incident. Next, the abdomen is soft, and then the uterus is a half finger breadth above umbilicus, soft in this place to the right. Next, we have a moderate lochia, which will be discussed later by our guest. And after that, there's a midline episiotomy with intact suture because vaginal delivery. And after that, there's a perineal edema. And bladder is firm upon palpation above symphysis pubis. And lastly, it is resonant in percussion. Now, let's go to the vital signs. So for the blood pressure of the patient is 100/80 mmHg, lower than the standard 120/80. As for the respiratory rate, we have 26 BPM. For the pulse rate, we have 68 BPM, which is normal. And finally, for the temperature, we have 36.2 degrees Celsius. Now, let's go to the questions. First question is that, why is it that ongoing assessment is crucial during the postpartum period? The answer is simple actually. So with proper assessment, the nurse should be able to identify and specify such discomfort the patient feels. Next, assessment can mainly be accomplished with a health interview. As stated on the Book of Love, assessment is composed of awareness of prenatal, natal, and medical history, along with the physical examination and analysis of laboratory data. It is important to ensure that the physical changes such as uterine involution are occurring by evaluating uterine size and consistency and the amount of lochia flow along with psychological evaluation. This is then needed to be done in order to identify such complications that may occur and to be able to give proper nursing intervention as soon as possible. Furthermore, careful assessment and effective intervention can reduce such anxiety felt by the patient. Thus, effective postpartum care by the nurse and consequently effective postpartum activities such as breastfeeding and proper skin-to-skin contact will be done by the patient. Next question is to identify the possible discomforts of the mother after delivery and during lactation. What essential patient teaching can we give? So the answer for that is as prioritized, the patient verbalizes of pain in the perineal area and could hardly walk straight. This is due to midline episiotomy as resulted from vaginal delivery undergone by the primigravida or primipara patient. Also, The patient also complains about uterine retention. Finally, the patient expresses anxiety and worry on being an effective mother given the situation she's in. Taking this collectively, the nurse must be able to provide comfort and relief for the patient, such as seats bath, cool compress, in order to soothe the perineal area.
Also, the nurse should educate the patient on the importance of mother-to-child interactions such as breastfeeding. Additionally, it is best to let the patient express her feelings and or pain. This is to further help in reducing the anxiety of the patient and further expand her understanding on the importance of postpartum care and activities.
Next, focusing on maternal self-care, what topic areas and instructions are we going to include? After giving instructions and assurances that the patient and the baby are healthy, the patient should be able to prepare to monitor herself upon going home. And so, patient teaching is essential. After that, according to FLUG, instruction should also include ample time for health teaching such as care of the newborn and the ability or the need to for a flexibility in care because the patient doesn't yet know what their new life will be like. Moreover, brainstorming with parents, practicing to produce at least three different methods of reaching a particular goal is excellent practice for parenting because giving advice is only solved for an immediate problem. Helping parents learn good problem solving techniques improves their ability to handle many challenges that will arise with child rearing. Refer parents and their partners to helpful websites and other resources when appropriate. For the first question, we are tasked to describe lochia. And for that, we have a special guest. So the nursing prof, what is lochia?
Hi everybody, I am that nursing prof. In today's video, we're going to be talking about the different types of lochia. So let's get into it. So first of all, what is lochia? It is the vaginal discharge. So after you have a baby, when you're postpartum, you have a vaginal discharge. Most people just refer to this as the blood or the bleeding after delivery. And yes, it is mostly blood. So it contains blood, mucus, and then parts of the necrotic decidua. So that's what's in it, but most people just call it the blood. It should either have no odor, or if it does have an odor, it should be similar to like your menstrual flow kind of odor, like during your period, that kind of odor. It should never have a strong odor because that would be indicative of some sort of infection. So there's 3 stages of lochia, and they do have to go in this order. So first we have lochia rubra, which is like the bright red bleeding. This is the kind we have initially after delivery. And usually it is the heaviest in the first 2 hours after delivery. So when you're still in that like recovery stage, it'll be bright red. It'll last 1 to 3 days on average and may contain clots. And now when I'm talking about blood clots here, I'm talking about small blood clots, okay? So the size of change, like nickels and dimes, little clots, things like that. Big clots, it doesn't matter what stage you're in, big clots are never normal. So big clots being an egg or bigger, that's too big. Then after rubra, we go to serosa, which is either like a pinkish color, or a lot of times it's more like that dark reddish brown color, kind of like that color that old blood is, if you can picture that in your head. That's serosa. At this point, we should have no clots. Any clot of any size, even little ones, would be abnormal at this point. And then for some women, this may last up to 27 days. And then the final thing it goes to is something called alba, which is a yellowish to a white in color. It starts on day 10 and can last up to the whole 6 weeks. So the whole 6 weeks postpartum, you could have this yellow to white color. It's very, very important that it goes in this order, okay? So it has to be rubra, serosa, alba. You never want it to go backwards, okay? And I put that over here. It should never go backwards. If it is, like if you're already at serosa and then it goes back to rubra and it's that bright red, you need to call your doctor. That's not normal. That's not okay. A lot of times it means infection.
Next question. With Mrs. Bay's behavior, how are we going to approach and reassure her?
Upon establishing rapport, the best course of action a nurse can do is to utilize a therapeutic communication. Therapeutic communication encourages the patient in elaborating their story while avoiding any cues that discourages the storytelling.
Additionally, upon securing and assuring that the patient's feelings are true and valid, it is advised to teach the patient for the proper postpartum care. Consequently, it is best to brainstorm with ideas to further expand their knowledge and inclination towards caring for their child. And for the sixth question, how are we going to encourage her to breastfeed her baby? And how are we going to assist her?
As proven by the study of Bush, first-time mothers may need additional breastfeeding support and lots of encouragement and assurance to continue efforts to breastfeed.
Whether woman continues to breastfeed after hospital discharge is influenced by such factors such as lactating support, latch, milk supply, employment, personal habits, and how important they view breastfeeding to be for themselves and their newborn. Moreover, various theoretical frameworks focusing on lactation have emerged. An example for that is a tri-core lactation model, which is an evidence-based practice model that has a goal of helping nurses in providing early postpartum lactation. Next, we have incorporating breastfeeding support, education, and maternal self-efficacy strategy to improve a mother's chances of successful lactation. And applying this effectively and efficiently would induce the success rate of patient providing sufficient breastfeed to her child. And for the final question, we need to identify various breastfeeding positions. And for that, we also have our special guest, Intermountain Healthcare. Take it away.
There are many different holds that the staff at the hospital can show you, and we will review a few of them here. Every mother and baby has different needs and preferences, so experiment to find the one that's best for you. Remember that good positioning always starts with getting yourself in a comfortable position. Use pillows, and remember to always bring the baby to you instead of bringing yourself to the baby. There are 4 positions that we will demonstrate in the hospital to help position the baby and to get the baby latched on correctly and comfortably. The cross cradle hold works well for small babies or those that have had a hard time latching on. Start by placing a pillow on your lap to support the baby in a semi-reclined position. Choose the side you're going to start on and aim the baby's head in that direction. Turn the baby tummy to tummy, because if you've ever turned your head to the side and tried to swallow, it's difficult. So tummy to tummy is always best. Now support the baby's body in your forearm and use the hand that's on the same arm that's supporting the baby to hold the baby's head. This keeps your other hand totally free and available to manipulate the breast and latch your baby on. Now tip the baby's head back into a drinking or sniffing position with the baby's mouth at the level of your nipple. The football hold is a favorite of many mothers because babies seem to latch pretty well in this position. It's also preferred for women who have had a C-section because it doesn't put added pressure on your incision, or for mothers who have twins because they can latch 2 babies on at once in this position. Start by placing pillows at your side and behind your back. Then lay the baby on the pillow perpendicular to your body. Support the baby's body in your forearm and head in your hand, tucking the baby's legs between your arm and body, like you're carrying a football. The side-lying position is another good option for mothers who have had a C-section because it keeps your baby off of your incision. Lay down on your side and set your baby next to you, tummy to tummy. Use pillows to support your back if desired. Support your baby's head in your hand. When it comes time to switch sides, hold your baby close to your chest and roll onto your other side. The cradle hold works well for mothers and babies once breastfeeding is well established. Make sure that you have good back support and use pillows or armrests to raise your baby to the level of the breast. Lay your baby across your lap, tummy to tummy, and support your baby in the arm on the same side of the breast that your baby is nursing from. Your baby's ear, shoulder, and hip should all be in one straight line. One important part of positioning, no matter what hold you're using, is nose position. Make sure that your baby's nostrils are always free and clear. They're nose breathers and can have a hard time breathing if they become smothered by breast tissue. If you notice that your baby's nostrils are obstructed, reposition your baby. For example, if you're holding your baby in the cross cradle hold, gently push your baby a little bit closer to your armpit, and that should clear the baby's airway. In the beginning, expect to have to hold your baby onto the breast at all times, and be ready for them to rear their head back during a feeding. A gentle hand on their head will help to prevent them from quickly pulling off, which can cause you pain. The first few feedings will feel awkward. It's a new sensation for you, and the positions will feel awkward. It's definitely worth the effort though, because there are so many health benefits for you and your baby. Be sure to talk to your nurse or lactation specialist if you have more questions about positioning.
I hope that you've learned something for today. And for this video, I want to thank Mr. Sesh Laguardia and Mr. Roel Garcia for their participation on this video. The nursing care plan and then the drug study can be downloaded down below. And for more content like this, make sure to click that subscribe button and ring that notification bell. Once again, I am Corbin and I'll see you on the next video. Stay sharp and stay smart.